This Family Life News podcast is made possible by the support of listeners like you.
Healthcare is big news and big business. 1 out of every $6 in America is spent on healthcare. If you're looking at your own individual household, it's about 18% on that as well, unless you're in the lowest income bracket, where 1/3 of your household income goes for medical expenses. Plus, there's new news about measles and vaccines coming out, and a new Health and Human Services Secretary. For One Doctor's Perspective, we bring in Chad Savage. He is a physician with Samaritan Ministries. Dr. Savage, let's start with Robert F. Kennedy Jr. How will the new HHS Secretary affect how Americans individually deal with health care?
Well, RFK is sure going to change a lot of things. He's going to kind of change focus of where the government is looking to improve health. And some of the biggest areas that created contention and actually made his nomination somewhat sketchy, whether or not he would go through, are actually some of the things that I think actually make him the right man for the right time. He has been called by some people a vaccination skeptic. But I would actually argue that what you've seen since COVID is an absolute erosion in trust by the American populace to healthcare establishment. And we are seeing a vaccine hesitancy as physicians or reluctance of patients to get vaccines at levels we have never seen before. And this is because of how the COVID pandemic was handled, which I think was actually fairly poorly. So I don't think if they got another yes man in there, another kind of carbon copy of what we've had before, they would ever be able to reestablish trust. Because if he can get in there, and if you believe what he testifies to, that he is actually open to evidence and persuadable, that he will be able to, with a skeptical eye, look at all the data. And if he comes out and says, you know what, we need to make some tweaks here, or, this over here is really good, and this other thing may be totally bad, we can have a little more faith that he's coming from, because he is coming from a cynical point of view, that what he's saying may actually help reestablish trust in a way, once again, a yes man never would be able to.
What do we need to know about whether children need their childhood vaccinations, or if there are certain people for whom this is the right medical choice, even though you have some political qualms?
So I think the big thing with the COVID vaccine was it was a 2-month study, which at the time kind of seemed logical. I mean, the belief was that this was an emergency. A lot of people were dying, and if this was something that could have prevented it from propagating, that getting it rushed out to the market would be appropriate. In regards to kids specifically, as you mentioned, it was never an emergency in that population. So people who, like myself, who are a little bit skeptical about its use in that population, thought that the government's attempt to mandate it into children and now in many universities and to go to school was totally inappropriate. And a lot of people sensing that, whether they were right or wrong, became maybe even more reluctant to accept the existing recommendations on all vaccines, even those that had better data behind them. So that's where, again, I think somebody like RFK is really going to be important. And what's really kind of cool about it is that he's not only just addressing the vaccine issue, but he's looking at foods and even how we finance medical care. Really important, because one of the reasons we've lost control of healthcare is how we finance it. We're financing it through the government. We're financing it through insurance companies. And when we do so, we're giving up our freedom to control decisions for ourselves. And that creates a general resentment. How did we get to the point where we're subjugating ourselves to the decision-making of bureaucrats and administrators?
We're talking with Dr. Chad Savage of Samaritan Ministries International, getting his take on the Family Life Newsmaker line today. The way that healthcare has changed in the last, 20 years, certainly, it is much more corporate, much more conglomerate. A lot of hospitals bought up by big corporations, even doctors' offices. You don't have your own local clinic. It's a subsidiary of something that is huge and big. How does that affect people's ability to talk with their doctor, see the same medical professional each time, and be able to trust, yes, take this vaccine, here's a surgery you may need, that kind of thing?
Well, in its fundamental nature, medicine is very much relationship-based. And we've lost that with the corporatization of medical care, where doctors are being pushed on one end to try to produce more and more and more, which just means more visits and more revenue. And we're losing the human aspect. And yet I would argue as a primary care physician myself, that that's one of the most fundamental aspects of the medical relationship is that trust and understanding between the doctor and the patient. Getting back to that relationship medicine is not only it's just a creature comfort good thing. We know that patients who understand that their doctor is working for them in their best interest are much more likely to adhere to their recommendations.
Dr. Chad Savage, thank you for your perspectives on what it's like to be a physician taking care of your patients. I'll offer this to our listeners as well. You should check with your own physician for advice on what to do with your medical care. I'm Greg Gillespie, Family Life News.
Thank you for listening to this Family Life News podcast. If you've been encouraged by what you've heard, please share it with others and click the subscribe button to automatically receive future episodes. Family Life is a listener-supported ministry. Podcasts like this are made possible by your financial partnership. Find out more at familylife.org.
From the breaking news stories that are shaping your world to the issues that matter most to you and your family, Family Life News will keep you up to date on what's happening. You'll get the information you need and the faith-based perspective you want from a news team you can trust. Family Life News, covering New York, Pennsylvania, our country, and our world, with hourly newscasts, weekday mornings and afternoons, and our weekday broadcasts of the Noon Report and the 5 o'clock Report. Family Life News, the news you need when you need it. A friend you can turn to, Family Life.